Pancreatic cancer is often called the silent killer because many people don't experience symptoms until the disease has already spread. Every year, thousands of lives are changed by this aggressive cancer, but recognizing the warning signs early could make all the difference. In this video, we're going to discuss what pancreatic cancer is, the symptoms you should never ignore, how doctors diagnose it, the different stages, treatment options, nutrition during treatment, and what you need to know to protect yourself and your loved ones. What is pancreatic cancer? The pancreas is an organ located behind your stomach. Although it's relatively small, it plays two extremely important roles. First, it produces digestive enzymes that help your body break down food. Second, it produces hormones like insulin and glucagon, which help regulate your blood sugar. Pancreatic cancer develops when abnormal cells in the pancreas begin growing uncontrollably and form a tumor. The most common type is called pancreatic ductal adenocarcinoma, accounting for about 90% of all pancreatic cancers. Unfortunately, pancreatic cancer is one of the most difficult cancers to detect early because the pancreas sits deep inside the body, allowing tumors to grow without causing noticeable symptoms. Who is at higher risk? Several factors can increase your risk. Smoking, obesity, type 2 diabetes, especially when it develops suddenly later in life, chronic pancreatitis, family history of pancreatic cancer, certain inherited genetic mutations such as BRCA1, BRCA2, PALB2, or Lynch syndrome, being over age 60. Heavy alcohol use that contributes to chronic pancreatitis. Having one or more risk factors doesn't mean you'll develop pancreatic cancer, but it does mean staying informed and talking with your healthcare provider is important. What are the signs and symptoms of pancreatic cancer? One reason pancreatic cancer is so dangerous is because symptoms often don't appear until the cancer has advanced. Common warning signs include persistent upper abdominal pain that may spread into the back, unexplained weight loss, loss of appetite, yellowing of the skin and eyes, known as jaundice, dark-colored urine, pale or clay-colored stools, itchy skin, nausea or vomiting, fatigue, new onset diabetes or diabetes that suddenly becomes difficult to control, blood clots with no obvious cause, difficulty digesting fatty foods. If these symptoms persist or worsen, it's important to seek medical attention promptly. While many of these symptoms can be caused by conditions other than cancer, they should not be ignored. How is pancreatic cancer diagnosed? Doctors typically use a combination of tests to make the diagnosis. These may include blood tests, liver function tests, bilirubin levels, tumor marker, a 19-9, which may help monitor treatment but isn't reliable enough for screening by itself. Imaging studies, doctors may order CT scan, MRI, endoscopic ultrasound, EUS, PET scan, in selected cases. Will you receive a biopsy? A biopsy is usually required to confirm the diagnosis. During an endoscopic ultrasound, a small needle is guided into the tumor to collect tissue for laboratory examination. Genetic testing of the tumor may also be recommended because certain mutations can affect treatment options. What are the stages of pancreatic cancer? Doctors classify pancreatic cancer into stages based on how far it has spread. Stage 1. The cancer is confined to the pancreas and has not spread. Surgery may offer the best chance for long-term survival. Stage 2. The cancer may have spread to nearby tissues or lymph nodes, but has not spread to distant organs. Treatment often includes surgery, chemotherapy, and sometimes radiation. Stage 3. The cancer has grown into major blood vessels near the pancreas, making surgery more difficult or impossible initially. Treatment usually focuses on chemotherapy and sometimes radiation to shrink the tumor. Stage 4. The cancer has spread to distant organs such as the liver, lungs, or lining of the abdomen. Treatment focuses on slowing cancer growth, relieving symptoms, maintaining quality of life, and extending survival. What are some treatment options? Treatment depends on the stage, overall health, and personal preferences. Surgery. If the cancer is found early, surgery may be possible. Procedures include Whipple procedure, distal pancreatectomy, total pancreatectomy, chemotherapy. Common medications include FOLFIRINOX, a combination of several chemotherapy drugs, gemcitabine, nab-paclitaxel, Abraxane. Chemotherapy may be given before surgery, after surgery, or as the primary treatment for advanced disease. Radiation therapy. Radiation may be used before surgery, after surgery, to relieve pain, along with chemotherapy. Targeted therapy. Some patients whose tumors have specific genetic mutations may benefit from targeted medications. Immunotherapy. Immunotherapy is effective for a small percentage of pancreatic cancers with certain genetic features, such as mismatch repair deficiency or high microsatellite instability. Clinical trials may also provide access to promising new treatments. Is there a special diet during treatment? Nutrition becomes especially important because pancreatic cancer can interfere with digestion. Many patients benefit from eating 5 to 6 small meals daily instead of large meals, choosing high-protein foods such as eggs, fish, chicken, Greek yogurt, beans, and tofu, drinking plenty of fluids, eating soft foods if swallowing or nausea is a problem, using pancreatic enzyme replacement therapy if prescribed to improve digestion, limiting greasy or fried foods if they worsen symptoms, including healthy fats such as avocado, olive oil, and nut butters if tolerated. Working with a registered dietitian to maintain weight and nutritional status. If weight loss becomes significant, nutritional supplements or tube feeding may be recommended in some cases. Can pancreatic cancer be prevented? Although prevention isn't always possible, you can reduce your risk by not smoking, maintaining a healthy weight, exercising regularly, eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, limiting alcohol intake, managing diabetes and other chronic health conditions, discussing genetic counseling if you have a strong family history of pancreatic cancer. Pancreatic cancer remains one of the most challenging cancers to diagnose and treat, but advances in surgery, chemotherapy, targeted therapy, and earlier detection are giving patients more options than ever before. Knowing the warning signs, understanding your risk factors, and seeking medical care when symptoms arise can make a meaningful difference. This video is intended for educational and informational purposes only and should not be considered medical advice. It is not a substitute for evaluation, diagnosis, or treatment by a qualified healthcare professional. If you have symptoms such as persistent abdominal pain, jaundice, unexplained weight loss, or any other concerning health changes, consult your healthcare provider promptly. Never delay or ignore professional medical care because of information presented in this video. If this video helped you better understand pancreatic cancer, please like this video, subscribe to the channel, follow for more trusted medical information, and share this video with someone who could benefit from it. Your support helps us educate more people and spread awareness about important health topics.